Yes, good morning friends.
Good morning, sir.
So today's topic is meningitis. In meningitis, it is a very simple topic. We have to simply split it. That is meninges and itis. Meninges is covering to brain and spinal cord. So we consider that spinal cord is an extension of brain. Brain सब जगह नहीं जा सकता. So God has created this spinal cord, and coverings of this brain and spinal cord is meninges. जैसे हम लोग we are covered with our clothes, undergarments, clothes, coats, right? Similarly, these are coatings for a very important and vital organ, that is brain and spinal cord. It is like a prime minister of a body. So it has this coverings. So innermost layer is pia mater, middle one is arachnoid matter, third one is dura mater. So these are meninges, and itis is about inflammation. Inflammation means protective response of a body whenever there is any infection or injurious agent. So there are 5 cardinal signs of inflammation, that is redness, heat, pain, edema and punctiosa, that is loss of function. So simply we'll try to understand what happens when meninges get irritated or whenever it gets infection or injury to it. So first sign is fever, as body tries to protect. So first signs will be a fever. There is a scent that is also cause for fever. So there will be a redness. Due to this underlying process of inflammation, there will be a fever. So clinical features में you will get fever, number 1. It will denotes the evolution through redness and heat of inflammation. Then second sign is pain. Third sign is pain of inflammation. So pain, as CNS, central nervous system, is located in head, right? So there will be a headache. Pain in head, we know it as a headache, right? So pain. Third is neck stiffness. Whenever this meninges gets swelled, when it gets swollen up, so we can't flex it. जब we wear that cervical collar, we can't bend it, right? We have seen an example कि कुछ whenever we life jackets, we use this life jackets. So it is contains of lots of air, right? So we can't fold. We are not that flexible wearing that. So if this meninges get swollen up, so neck can't be we can't flex our neck. So simple test is we have to ask patient to flex their neck. So we can flex it, but patient who is having meningitis will be having a severe pain due to this neck stiffness. It is due to edema in inflammation. Then there is also photophobia. So whenever the word meninges comes for your exams, or these 3 words you should utter, that is fever, then headache and neck stiffness. Reason behind it is as and punctiosa, so there will be functions will be disturbed. So on examination, whenever you examine a meningitis patient, so these are 2 important signs or examination things we have to do. First one is Kernig sign. So we are going to see it. Yes, please come. So in Kernig sign, what happens is that we have to ask patient, if a patient is lying down, so we have to simply flex his knees, flexion at hip joint, and then gradually we have to extend knee, and there will be a hamstring spasm, or we couldn't be able to do this extension at knee joint. So it is called hamstring get flexed or contracture हो जाएगा. So this is the Kernig sign. So I will repeat again. In Kernig sign, we have to do first hip flexion, then try to do this extension at knee joint. So hamstring, these are hamstring muscle, it will contract. So there will be a flexion of hamstrings. It is called a Kernig sign. Second one is Brudzinski sign, in which passive, you have to lift patient's head and try to touch his chin to chest. So there will be an immediate flexion at hip joint and knee joint. So it is like a fan ka button dabaya और fan is started. Like that, when you do simple this movement, that is passive flexion of neck, there will be a flexion of hip joint and at knee joint. Okay, so thank you so much. So these are the two important signs. So in nutshell, meningitis, there is an inflammation of meninges, fever, headache, neck stiffness. Then on examination, Kernick sign and Rudzinski sign. An important social issue is that this is a vicious circle. So malnourishment leads to infection, infection leads to malnourishment. So this is a vicious circle. So this key vicious cycle you can add in your answers or in PSM also. So that's it for today. Thank you.